I think I disconnected myself, and I hope that you can come back. I hope I'm not alone talking to myself. I can't see anybody here yet. Let me see on my phone if I'm back. Boom. Some of them have crossed the line of nope, I can't see if I'm back yet. Why? Am I live? Because Mom, I am live. Okay. Back. Tracy says I'm back. Okay. Claudine says back. Luann says back. Okay. I thank you. I don't know. I hit the wrong button. Sorry, everybody. Oh, I see there's that red button at the bottom that says end live video, and I must have clicked it by mistake. So I'm back. And so if you have questions, send the questions again, please. Copy and paste or send them back here. And hopefully I'll see them this time. Tracy asked the question, how about iodine in Hashimoto's? That's a really good question, Tracy. And iodine is a critical component for thyroid function. The Midwest of the United States is called the goiter belt. And people get swollen thyroids, not so much anymore because of the international distribution of food, but back in the 1910s, 20s, 30s, 40s, the goiter belt was through the Midwest because there was never an ocean around there, so there was no iodine in the soil. And the crops that grow there didn't have any iodine because there's no iodine in the soil. And then iodized, that's why Morton's iodized salt came out. I don't know when they came out. Must have been probably the 1930s, something like that. My grandparents actually lived right across the street from the mine, the Morton's iodine salt mine in Detroit. And as a kid, I remember that mine across the street. Lots of cars parked in the parking lot. You know, they'd have to go down, and I never went down there. But in any event, so iodine can be really important. I do all go off on a tangent, don't I? That's cute. I think I'm cute sometimes. So iodine can be really important for thyroid function. But you don't just shotgun iodine in. You know, you have to see, do I have a need for more iodine? And how do you do that? Well, you can do urine tests or blood tests can identify it. And the easy way is get some iodine at the local pharmacy. It's a little bottle. It's a little liquid with an applicator tip on the cap. Unscrew it, and the applicator tip's on there. And when I grew up, we called it mercurochrome, and it turned out to be full of mercury. Mercurochrome. But you get iodine from the pharmacy, and you just unscrew the cap, and with the applicator tip, just rub some on your belly. Make a little square of your belly and fill it in with what you pull up from just dipping it once. You don't keep pasting it on there. Paint it on your abdomen. Don't take a shower and don't exercise. And that should be still there 24 hours later. If it's not still there, what that suggests is that your body went and sucked in the iodine because it needs some iodine. And we used to tell patients to get a bottle of that stuff and do everybody in the family. And those that need iodine, take some iodine. And about once a month, maybe on the first of the month, every month, you just do the iodine paint test. You know, you just paint a little on there again and see if it's still there 24 hours later. And it'll fade a bit, but it's still obviously still there. But many people will find in an hour it's gone, in 3 hours it's gone, and it hasn't gone into your clothes because it dries really quick. It's been absorbed into your body. So that's just a general idea, Tracy, of how to get some iodine, how to test to see if you need more iodine. But in general, people with sluggish thyroids need more iodine. But if you take too much iodine, it can be a problem. So you just want to make sure that your body needs it before you shotgun it in and just take, oh, I've got a thyroid problem, I'm going to take iodine. You know, many doctors have just prescribed iodine with hypothyroids, and those people do well. They do really well. But on occasion, you get somebody that has a problem with that because you've taken them over the edge. Now they have too much iodine. Okay, so just check, Tracy. Just check and see if that's necessary or not. That's an easy way. Once again, you can do urine tests and blood tests for iodine levels also. Tracy also asked if I can talk about LDN. LDN stands for low dose naltrexone. I've keynoted the LDN conference 3 years, maybe 3 or 4 years in a row, and haven't gone for 2 years now. My schedule hasn't allowed it. The timing was off. But low dose naltrexone is such a remarkable product. And those conferences, the past LDN conferences are all available online, and you can just listen to oncologists talking about how they use LDN with their cancer patients, and they give case studies of the results and how remarkable the results are. LDN low dose naltrexone, not large dose naltrexone, but low dose naltrexone, has practically no side effects. I think it competes with powdered nystatin as medication with the lowest level of side effects possible. You know, hardly any. Possible, I guess, to have a side effect, but hardly noticeable at all. And for many different conditions, doctors present about using it with Hashimoto's thyroid disease, with cancers, with MS, that it helps with chronic fatigue, with multiple chemical sensitivities. It helps with so many different things. And here's the reason why, is because LDN binds onto your endocannabinoid receptors. The endocannabinoid receptors are throughout your body. They're in your gut, and they're throughout your body. They're in your brain, and they're throughout your body, and they're in your nerves, and they're throughout your body. And you get the message? They're throughout your body. That means they're everywhere. And LDN stimulates those endocannabinoid receptors to calm down, so that if there's inflammation, it's an anti-inflammatory. It's remarkable how general a treatment program this can be for so many different conditions. It's just remarkable. Now, here's the really good news. You need a prescription for LDN. But do you know what else binds onto endocannabinoid receptors? And quite honestly, I've been looking into the difference between the therapeutic benefits of LDN and CBD. This whole buzzword that's out there now about CBD, the cannabidiols from the hemp plant. CBD is not psychoactive. Oh, for all of you out there, you might not know, I wrote an ebook with Dr. Mary Clifton on CBD. It's called The Grass is Greener, and it's on Amazon. I think it's $10. And I talk a lot about CBD, and I give you, and Marzi will put the link in there, and I give you lots of studies about CBD. It's unbelievable. In the journal Oncology, the #1 cancer journal, arguably the #1 cancer journal in the world in the English language, they talk about children's tumors and using CBD. And with the most common type of children's tumors, every single children was better when they took CBD. The tumors shrunk, their pain reduced, and there are absolutely no side effects. And these researchers in the journal Oncology said, we have no hesitancy saying every child with these tumors should be taking CBD. And in the Brazilian Journal of Oncology, they looked at patients with drug-resistant epilepsy, meaning they've tried at least 3 drugs and they don't work. People are still having seizures. 10 out of 10 people with drug-resistant epilepsy put their seizures into remission with CBD. And it's unbelievable. He said, what? This is like the miracle cure. Well, how come there's so much resistance to it? Because there's no profit in it. Now, there's these people out there today making CBD products, and some of them are really good and some of them are not. And the one that's really good is Cannadapt, Cannadapt. Marzi will put a link in there for you for that one, Cannadapt. That one you can count on. I happen to be the chief science officer for that company, so that's my full disclosure on that. The company is called Sunhorse Energy, like the sun. Their products are just remarkable. And that's a whole nother topic of discussion about adaptogenic herbs. But for CBD, every time we've done blind paper bag tests with different CBDs, everybody picks Canadapt. Everyone does. So CBD works on the same receptors that LDN work on. And I can't find a difference in the literature. I've looked at what is the difference in mechanisms in terms of the benefit of LDN versus CBD. I can't find a difference. There might be one, but I haven't been able to find it yet. So Tracy, I hope that helps a little with your question about LDN. Jocelyn says, baby steps, is Corelle dinnerware okay or stoneware? I don't know what Corelle dinnerware is. The problem with, and I don't know that stoneware would fall into this category. The problem with ceramics is the paint that they use, that sometimes that ceramic paint is high in lead. So the colors in ceramic mugs and plates, sometimes the paint is high lead paint. So if you can confirm there's no lead in the paint with ceramics, that'd be okay. Corelle dinnerware, I just don't know what the components are, so I can't comment on it. Sorry about that. Claudine says, Dr. Tom, I was diagnosed with chronic Lyme recently. Oh, okay, sorry. I felt great on doxycycline and grapefruit seed extract for 2 months, but once I stopped, I felt worse, lots of joint pain, brain fog, and neck pain. Do you think getting a food sensitivity and zonulin test to find out IgG sensitivities would help if I eliminate sensitivities? Absolutely, Claudine. Identifying your sensitivities and reducing the load, because you've crossed the line of tolerance. Most of us, if checked, there is some evidence of Lyme in us. Most of us now have some evidence of that. But why did you cross a line and have the symptoms and thus the diagnosis? Why? Well, because your immune system is fighting this and fighting this and fighting this and fighting this. And the more that you can reduce the need for your immune system to fight all these other things. Now, you don't suppress the immune system. You get rid of the need for the immune system to be activated. And this is the key to preventing autoimmunity also. Claudine's question is really relevant for everyone out there, because this is the big kahuna. This is the protocol that you use to protect you and your family from the #1 mechanism of getting sick and dying in the world, whether it manifests as atherosclerosis and cardiovascular disease, or neural inflammation and Alzheimer's or Parkinson's. This is the mechanism. Reduce the toxic load. And unfortunately, this world that we live in is not going to change. It's not going to get better. It's only going to get worse. And until we create a world that just doesn't put up with all these toxins anymore, meaning all the plastics, all of the chemicals that we're exposed to. So in the meantime, Claudine, reducing your toxic load. Now, you've heard me say before, the most common source of gasoline on the fire causing the inflammation in the body, the most common source of gasoline is what's on the end of your fork. What you're eating is triggering inflammation, the highest level of inflammation for most people. It's the most common source of inflammation is what you're eating, because you don't feel sick when you eat it, so you think it's fine. But you all heard me say, y'all, I guess I'm talking to the southern part of the country now, y'all heard me say before that I was being so cute, I forgot what I was going to say. Well, that doesn't work very well. You've all heard me say before that the most common source of inflammation is what's on the end of your fork. So you have to identify what that is. And Claudine, the tests that I would recommend are the Zoomers, because you zoom in on the problem. And the technology of the Zoomers is the most comprehensive, most accurate technology in laboratory testing that's out on the market today. And this laboratory called Vibrant Wellness that does these Zoomer panels, they've been pretty aggressive in their marketing and pricing, being extremely competitive with lots of different deals. And there's some great packages of different Zoomers. You get the wheat Zoomer, the dairy Zoomer, the lectin Zoomer. Marzi will put some links in here for you guys about the Zoomer panels so that you can take a look at them. They're really impressive tests. Okay, Paula says, love your info. I have give lots of your book away. Oh, so you give lots of my books away. Thank you, Paula. It's actually a really great gift, isn't it? Is to give the books to people that you love. Tracy says, you're definitely cute, but Marzi is pretty. Okay, thank you. Thank you. Sabrina says, I'm reading You Can Fix Your Brain and I love it. Thank you, Sabrina. Thank you so much. Christy says, thank you for all the work you do to keep us informed. I love your white smile. Any natural tip? Brush, I guess. No, your oral microbiome has a whole lot to do with discoloration. There will be a new summit coming out in a couple of months on the oral microbiome. My friend Dr. Pedram Shojai picked that topic, and I gave him a list of some docs to interview and things, and he had many others, and it's going to be a great event. We'll send you announcements when it happens. But, you know, we have so much toxic bacteria in our mouths that we don't realize that we've got. The microbiome we often think of as just the gut, but no, it starts at the mouth and goes to the other end. It's the entire GI tract. The microbiome of the entire GI tract is really important to address. Marilyn says, I've had polymyalgia for 3 years and can't get off the prednisone even after cleaning up my diet, environment, and emotions. Any suggestion? Oh, Marilyn, there's some really good studies. I've got great pictures in my CGP course. Remember, if you pull at a chain, it breaks at the weakest link. And for some people, the weak link is their brain. For some, it's their thyroid. For some, it's their bones. They get osteoporosis. For some, it's their muscles, and they get polymyalgia. And I've got really good pictures showing the white blood cells, the excessive number of white blood cells in the immune system. And it was maybe close to a year ago now that I talked about a young girl from Sweden that asked for help, and she passed. And we never were able to get to her to help her. And my strong suspicion, I talked about it on Facebook Live, my strong suspicion was it was the incredible amount of tattoos that she had and the poisons of the ink in the muscles that the immune system was fighting, and that created the autoimmune mechanism. So I don't know that you have tattoos, but there clearly is an overwhelm of your immune system right now. I would recommend you have a consultation with Michelle Ross, my director of clinical services, because we've worked with these people before, and you have to identify, where is this coming from? Where is the inflammation coming from? So there is a trigger. There's probably more than one trigger on where it's coming from, but we'll find it. But that's what you have to do, is identify where is the trigger coming from causing the inflammation. Missy says, it took me about 2 years to battle Lyme, but I did it. There are so many factors to Lyme they can hide in biofilm. Absolutely right. I can send you some great Lyme doctors to follow after Dr. O'Brien, if interested. Thanks, Missy. So Missy's dialed that one down, so she's got a lot of information on that. Carmelina asks, is that the same iodine that they use in IB dye in hospitals? Most likely. I don't know what they're using in hospitals, but most likely it is, or very similar. Luann says, I have eosinophilic esophagitis caused by food allergies. I'm lost the question. It just disappeared. So you want to find out, so the couple things have to happen when you've identified foods that are triggering inflammation, in this case in the esophagus. You have to not only eliminate the triggering foods, you have to rebuild the inflammatory microbiome that has developed as a result of eating those foods for a long time. Margie says, hi, Dr. Tom, great to be here again. I have 15 diseases. Would LDN help me? Most likely, it's an excellent anti-inflammatory. Excellent. CBD is also, but there's probably, I can't even say this because there's so many studies on CBD, but there's probably more information available on LDN. It's been researched for a longer period of time, is my suspicion, but there are hundreds of studies now on CBD. But LDN is certainly worth an effort, as CBD would be an effort for you. It's certainly worth trying it. Kelly says, love your show. I give your books as gifts. Thanks for all your hard work. Kelly's in Celine. Celine, oh, Kelly, I was married. My first marriage we did in Celine. I lived in Ann Arbor, and Henry Ford had a coach house there. And it was remodeled and used as a meeting place. It was very cool, a little stream by there. And Gabriella's here from Peru. Hello, Gabriella. Nice to see that you're here. Thank you so much. Joan says, LDN did not help me, but I know people that it helped. Right. There's no sure cure for everybody. Simi says, I was tested for celiac as negative, yet I have all the symptoms, bloating, migraines, itchy, leaky gut, brain fog, chronic fatigue, etc. So I have been gluten-free since 2009, but if I have gluten anytime, I still suffer. Why does it come up negative? Well, you may not be a celiac, but you have a wheat-related disorder. That's worse than being a celiac. It's just that celiac's gotten the press for so many years, but now there's a lot more about this. But Simi, I'd suggest you have a consultation with our team. And Michelle Ross is a celiac. And she also was a fourth grade teacher for many years. So she's an excellent teacher. She's an excellent educator, and she knows this one really well. She and I have had years of discussions about celiac and what to do about it. So that's at consultations at theDr.com. Sabrina says, hello, neighbor. I'm in San Diego. Hi, Sabrina. Unfortunately, I moved from San Diego, but it's nice to see you're here. Mary said, what if I had radioactive iodine destroying my thyroid? Is there a need for iodine? I don't think the two are related, Mary. There is a iodine that is radioactive. It's a really toxic substance. And then there is the iodine that is a mineral that we find in our food to some degree and in our iodized salt. They're not the same. What do you think is the root cause of large ovarian polyps? Almost always, as far as I know, almost always with ovarian polyps and cysts, there is a history of metabolic syndrome, which means insulin resistance and metabolic syndrome. I would want to know what your HOMA score is, HOMA, your HOMA score. And that would tell you if you have insulin resistance, which is the mechanism of metabolic syndrome, right? So, and these people tend to gain weight that they can't lose, even if they don't eat very much. Once again, that's something that you'd probably benefit from having a session with my team to understand more of what specifically can I be checking for. Is there anything available on the internet for hypothyroid? My doctor won't prescribe thyroid meds because my tests come in the normal range. I've been off wheat and grain since 2012. Well, if you've got normal level of thyroid meds and you've got thyroid symptoms, you don't want more thyroid meds. You don't want more thyroid hormone. You want to find out where are these symptoms coming from? How come I'm hypothyroid? So here's a simple question. If you're in an elevator in a hotel and the elevator doors open, can you tell right away that the swimming pool's on that floor? Oh yeah, I smell it right away. Well, everyone in the elevator can't smell it, but you can. You smell the iodine, or you smell the chlorine. You're likely chlorine sensitive. Chlorine binds onto your thyroid hormone receptor sites, so thyroid hormone can't get into the cells. You know, when the pitcher throws a ball to the catcher and the catcher catches it, that's how hormones get into our cells, is we have receptor sites that sit on the outside of cells, and the hormone goes into the cell, turns the doorknob in the receptor that opens the door and allows the hormone to go inside the cell. When you have chlorine sensitivity, the chlorine sits in the receptor site, it sits in the catcher's mitt, and the pitcher throws the fastball to the catcher, but he's got 3 baseballs in his catcher's mitt, and so the fastball bounces right out. The hormone can't get into the cell because the receptor site's full of chlorine. So people that are chlorine sensitive, and if you're sensitive to the smell of chlorine, you likely, it's not diagnostic, but it's a good indicator. You need chlorine shower filter, because that's where you get the most chlorine, is in the shower. You breathe the steam and it gets right in through your lungs. But someone like you with this kind of a problem, it's very helpful to have a session with my team. It's really helpful, just to get some good leads. Missy, who's here every week, says, how can we improve a sluggish lymphatic drainage? Oh, that's a really good question. And causes of lymph issues. Can it be from chronic immune system issues due to Lyme, thyroid issues, toxic overload? Thus, immune system always, and I just lost the question because new questions come in and it just popped up. That's a really good question though, Missy. Your lymphatic system is the garbage collector in the body. The lymph goes in between the cells. It doesn't go into the cells, it goes between the cells. So the cells, they do their work, and the exhaust of the cell doing their work goes outside the cell, called the extracellular space. It just throws it outside the cell, the exhaust. But the lymph system is going through in between all the cells, picks up all that exhaust like a garbage truck, picks up all that exhaust, dumps it into the thoracic duct right here on the left side, and then it goes out, down to the gut and out. So your garbage trucks are on strike. When you've got lymphatic blockage, your garbage trucks are on strike. You aren't collecting. You're just all this thick crud's there. So a couple things that help, and use it many times over the years, Castor Oil Packs. And I think I did a Facebook Live on castor oil. Yeah. We did with Dr. Marisol about 3 or 4 weeks ago. We did Castor Oil Packs in detail. She's the Queen of Thrones. And we talked a lot about Castor Oil Packs. Missy, that's a must when you've got lymphatic drainage problems, is Castor Oil Packs. They help a great deal. And of course, being extremely well hydrated and having enough minerals also are really important, so that the lymph can escort this, because you got thick lymph right now, most likely. It's blocked up. So it'll help. Jenny says, what if hemp is a cross-reactive food of mine? Can I take CBD? Not likely. Perhaps, but not likely. With wheat, if you're sensitive to one component of wheat, but not another component, you can't eat wheat. So if you're sensitive to hemp, one of the components of hemp is CBD, you probably cannot have it. So in that case, LDN would be a better alternative. Missy says, have you tried lymphatic massage? They're great. When you have a lymphatic massage therapist certified in lymphatic drainage, there's a school out of Germany. There's other schools now that I think are really good. But at the time, the school out of Germany was the premier school for being certified in lymphatic drainage techniques. Remarkable things they can do when you've got lymphatic blockage. Thanks for bringing that up, Tracy. It's absolutely right. Lymphatic drainage techniques are very helpful, and there are massage therapists that are certified in lymphatic drainage. They're great. Nikki says, what CBD do you like? By far, Cannadapt, Cannadapt. And we'll put the link here if Marzi can find it. She can't find it, okay. We'll find it and we'll put the link here after the effect, afterwards. Marzi, text Karen and ask her. Nikki says, what CBD? Okay, we just did that. Lori says, helps with spasms. Yes, it can. Yes, it can. Hi, Marzi. It's Margie from Perth. Ah, okay. So a message to Margie from Margie. Lori says, oh my God, doctor, tomorrow I have CRPs. I have to use LDN to control pain. I can't take opiates or pain meds or muscle relaxers. You have CRPS. Tomorrow I have CRPS. Okay. And I have to use LDN. I hope it helps. I hope it helps. Jenny says, I grew up in the South. Okay. Okay. Cynthia says, starting working with your team because I can no longer tolerate any fragrances, chemicals, etc. My world's getting smaller. My brain is my weak spot. Neurologist said I have brain of much older person and can see why I'm so forgetful. I'm looking forward to recovery. Way to go, Cynthia. One step at a time. So certainly, I'm sure the team's going to recommend you do the neural zoomer as a marker to see, all right, how many antibodies do I have now in my brain? And, we don't want antibodies in your brain, but you're going to have them. So let's find out how many there are. So 6 months from now or a year from now, you do the test again. Oh, look, I've got 3 antibodies in my brain. And if you do the test for the first time a year from now, because you got a little bit of problem still left, and you see you've got 3 antibodies, say, oh, what I did didn't work. No, you had 17 antibodies the first time that were elevated. Now you have 3 that are left. So you're on the right track. Just keep going, right? That's why you want the markers. So I'm sure the team will tell you all that. Way to go. And I really hope we can tell you, we can help you. Tali says, hi, doctor, I'm from Brazil. You're amazing. Thanks for your help. Thank you so much, Tali. Thank you so much. Claudine says, what about the KBMO with zonulin? I don't know what KBMO is. Maybe I'm supposed to know, but I don't know what that is. So I can't comment on that one. Tracy Holcamp says, how long? And I don't know how long what. Oh, she's replying to Lori. Okay. Lori Parker, sorry, not okay. Missy says, you are cute and we appreciate you so much. Come to Chattanooga anytime. Thanks, Missy. I'll come anywhere in the world. Put an audience together for me of a few hundred people. I'll come anywhere in the world to any doctors and any general public groups, any groups that you put together. I'll come talk about this. Have you researched alternative allergy technique? It claims to reduce, possibly eliminate sensitivities using acupressure. I'm intrigued, but also skeptical. Thoughts? This is Narumbad, N-A-E-T, allergy elimination technique. People get symptomatic relief, but then they tell the person it's okay to go ahead and eat that food now. And I'm like, absolutely not. And I've challenged these people for years because there's no question that some people get relief. Well, all right, if you've got a hot wire coming to the dashboard and you're driving your car and the hot light comes on, you pull over and turn the car off, get under the dashboard, find the wire that goes to the hot light, cut the wire, start the car, and see the hot light's not on anymore, and then drive away thinking everything's okay. Really? So NAET cuts the wire to the hot light on the dashboard of your car. And it works for a lot of people. There's no question. You get symptomatic relief. But you must check to see, are the antibodies still there? So if your immune system is still making antibodies, you can't eat the food. And if you don't get the migraines anymore from wheat because you did NAET, but you still get the elevated antibodies, which give you antibodies to your brain, if that's the weak link in your chain, you're still killing off your brain. You may not get migraines anymore because you cut the wire to the dashboard. Now, there's nothing wrong with cutting the wire to the dashboard, but how you feel is not a marker of whether or not you got a problem. How you feel is a marker if you've crossed the line of tolerance, unless you cut the wire to the dashboard. And NAET is the primary one. Can you tell I'm a little worked up about it? Because I've challenged these people for years. They've got thousands of doctors doing their technique. I say, look, just do some blood tests, identify antibodies that are elevated, then do your technique and wait 2 months for the antibodies that are produced just to die off and check again, are the antibodies still there? If they are, you haven't fixed that person. You've cut the wire to the dashboard so they don't have the symptoms, but they're still killing off their tissue, whether it's the thyroid or the brain or the heart or the lungs or the liver. The immune system is your armed forces, and it's going to do everything it can to protect you, right? So that's NAET. Gets really good results. A lot of doctors use it, but you got to check the immune system to see if it calms down. Lori Parker says, if constipated, then the oral microbiome goes to heck. Exactly right, Lori. From the mouth to the other end, it's one big long tube. Melissa says, I used to be his dental assistant. Replying to somebody. Okay. Tracy says, so cool, replying to Melissa. Okay. Annie Byron says, oh dear, I missed a lot. Phone conked out, Doc. I would like to set up a site here in Australia for your followers here. What do you think about that? I think it's a great idea, Annie. I'm going blank on Leanne. Leanne Scott is in Australia. Leanne is the Nutritional Therapists Association representative in Australia. She's got an entire network there. So maybe the two of you could connect. I think that'd be great. I was in Australia in January, and I would love to come back to Australia. I think the people are great there. Marzi just got the link for the CanAdapt, and so she'll be posting it in just a minute. Brian says, hi, Dr. Tom from Oxford, New Zealand. New Zealand, thanks so much. Any comments on PLS with which I am afflicted? What's PLS? You have to spell that one out for me, my friend. I'm supposed to know what that is, but right now I'm not remembering what that is, so you just have to tell me. Joyce says, I also have sciatica, nerve pain, and scoliosis and inflammation. Can you help me, please? Sure, Joyce, happy to. Just go to consultations at theDr.com, and we'll help you figure out as best we can as to what's going on. I started to talk earlier about Living Matrix. Everyone should do the Living Matrix. Go to theDr.com/Living Matrix. It'll take you a few hours, but we'll ask you, what was your mother's health like during pregnancy with you? What was the delivery like? Was she on any meds? And you say, I don't know. And my mom's passed. And I say, call your aunts. Call anybody, her old friends. Get as much information as you can, because the more information you get for us, the more we can do to help you. Kristen says, hi, Dr. Tom. For someone with autoimmune diseases and food sensitivities, what would be the top first test you recommend? No question, the Zoomers, the Zoomer panels. There's like 8 or 9 of them now, and they've got different price breaks. They're very competitive in their pricing, and Marzi will post a link for the Zoomers here for you. No question, they are the best. Carol says, hi from sunny Traverse City. What a great time of year to be in Traverse City. What a great time of year. I love Traverse City. Manuela says, help, I have ulcerative colitis. Now we did SIBO tests and tested positive to it. What we working first on? Leaky gut, I guess, too. Please help. Okay, Manuela, great that you got the test done and you've got SIBO, small intestinal bacterial overgrowth. So you need someone to work with you to figure out what to do. Go to consultations at theDr.com and have the team work with you. Do the Living Matrix. Do the 2 to 3 hour questionnaire of your health history so we can go back and figure out where all this has come from. Becca says, I have celiac and granuloma, and I just lost the question. Becca, please send it again because it went up too high. More questions are coming in. Julia says, I have hives and skin dermographia. Is that always, I think that should be food related, not good related. Is it always food related? No, nothing is always food related, but food, the most common source of inflammation is what's on the end of your fork. So that's where you start, is what's on the end of your fork. And I'm answering these questions, guys, because they're all the same. They're all the same. It's like, where is the inflammation coming from? Where is the why is the immune system activated? That's the way you have to look at this, is the big picture. Why is the immune system activated? Where's it coming from? Let's see. Mary Henley says, how would you know if you have lymphatic slug? So many different symptoms. You might have acne. You might have some skin problems. Your skin can feel old. It can look old. It can be dried. You just feel sluggish. You feel thick. Just Google symptoms of sluggish lymphatics, and just see what pops. You say, oh, I've got that. No, I don't have that. I don't have that. Yeah, I've got that, got that. You'll see. Cynthia says, got my pack from the Queen of Thrones. Way to go, Cynthia. We got ours too. The Castor Oil Packs she's referring to, folks, and they're great. They really help a lot. We posted, sorry that we can't find the link for Canadapt. Honey, did you get the link? Okay, we've got it now. Okay. Simi says, same time, I'll go on your site and look for Michelle Ross. My original question also mentioned I recently tested positive for Epstein-Barr. Doctor said there is nothing they can do for it. And now that I'm eating clean and taking supplements and pre and probiotics, it throws me into detox mode. I feel like I've been hit by a train and have gut issues and migraines. And for any suggestions? Yeah. We did one a number of weeks ago on detoxing. Oh, no, I did that Begin the Base Hits program. Yeah. There's a Begin the Base Hits. Marzi will post the link here. I did 4 sessions on how do you start for all of this stuff? How do you start? And this was specific. This was registration only. And one of them was on detoxing. I went through the whole detox process with Castor Oil Packs and all of the nutrients to take and when to take them and all that. That's the Begin the Base Hits program. And Marzi will post on that one. So again, the best thing to do is to go to consultations at theDr.com and make an appointment with the team so they can work with you on this. You can't do this by yourself, folks. Oh, right. Oh, Marzi just gave me the link. I forgot. I'm supposed to be telling you guys about Betrayal. Yeah, we're relaunching Betrayal, and registrations are on now. And what we're doing is when you register, we're giving you the link for episode 1 right away so you can see it. And it's just great. I just watched it the other day. Yesterday. And it's just great. And it's really wonderful to see all of the docs and the patients that are on Betrayal. So it's coming out. The rest of the episodes will come out in a couple of weeks. And when you register, there's 5 different free gifts that you download from some of my friends, from Sire G and I don't remember who else there was, but there are 5 different really great gifts that you get right away when you register. So Marzi's going to post the link for Betrayal. For everyone that's here, please register for Betrayal. Please help us. I really want to reach 1 million people with Betrayal. We're over 500,000 now, so we're on the way. And this is, it's Betrayal is the main reason why people stop me all the time in airports, in places, I see it now when it happens, I can see someone's looking at me and they're like this. And I just nod and I smile. It is you, right? And they say things, really nice things like you saved my life or you saved our daughter's life. And it's heartwarming. It's heartwarming to see the impact that Betrayal has. It's really great. Marzi and I are very proud to have put this together. So please help us carry this message out to the world. All of your family, all of your friends, please don't be shy. Send the link to everyone you know and say, hey, this really gives you a sense of where disease comes from, so that you can make some decisions in your life. I mean, it really is great. There's 9 episodes, and the first episode people can watch right with the registration, so they can then determine if they want to continue or not. And I can't imagine anyone wouldn't. So please help us with that. We'll post the link here, everyone. And it's now, what's the time here? It's 2:11 for me, 2 a.m. in the morning, but I'm going to stay on for just another minute or 2 and answer a couple more questions until I'm sure Marzi's got the link posted. It's posted for Betrayal. Okay. Let's see. Rose says he's talking about NAET at 32 minutes. Yes, NAET. Cynthia Rodriguez says, thank you. You're welcome. Peruse says, I'm absolutely right about the bear, BAER. Okay, thank you. D. Smith says, please help with COPD. Yeah, you really have to clean up as much as possible. You know, the lungs are full of crud. For one reason or another, there's a whole lot of crud and the lungs can't work very well. Absolutely, castor oil packs are important for that. And for something like COPD, Begin the Base Hits is a really great introduction for someone that knows nothing about functional medicine. Those 4 episodes, Begin the Base Hits program, is it gives people the guidance. How do you start with this whole process? The best thing is to work with my team. They're all trained by me, and they're great. But if you can't do that for one reason or another, then do the Begin the Base Hits program. Okay, DN says, thank you. That was a great explanation about NAET. Marzi, Kim just sent a message about, am I going to talk about the contest? Do we know? I don't know what to say about that. Misty says, I share this with my Facebook group, Scleroderma and Functional Medicine. A few members have autoimmune symptoms, but no formal diagnosis. Thanks, Misty. And please share Betrayal with them and post the link for Betrayal. Tracy says, any idea why CBD would hit positive as marijuana in blood work? Happened to 2 of my family. No. No. I don't know what to say to that one. It depends on what they're testing for. You know, CBD is a component of the hemp plant. What are they testing for when they test for marijuana? If they're testing for THC exclusively, it should not have come back positive. But if they're testing for hemp, it'll come back positive because CBD is in hemp. But it's not the hallucinogenic component of hemp. So it really is a question as to what are they testing in that test, Tracy? That's what you have to look for. Let's see. And there's the link for CanAdapt for Dr. Mary's site. Good, good. Okay. Kristen says, I can't wait for Betrayal again. I bought the package this time and can't wait to get it. I'm truly grateful. Thanks. Thanks, Kristen. Really nice of you to say. PLS, primary lateral sclerosis. Ooh. It's an autoimmune mechanism, my friend, and that's one that you really want to dial down comprehensively. So what do you do about that? Where do you start with that? You need to get educated, clean up your environment immediately. Get rid of the plastic storage containers in the house. Get rid of the plastic wrap. Get rid of the aluminum foil. Get rid of the toxins in the air. Get an air purifier. Get a water purifier. There's a whole lot you need to do. So you got a couple of options here. Either do my Begin the Base Hits program so you understand some of these basic things, or better would be make an appointment with Michelle Ross and get our team on this working with you, because that's not one to mess around with. You can't put your toe in the water with something like that. You need to dive in. Meaning, well, let's see, I got an air purifier, so that should help. Well, yeah, but you also need a water purifier, and you need a chlorine shower filter. There's so much. We have to reduce the toxic exposure you're getting, and then all the foods. We have to find out what foods work, what foods don't work right away, and then change your microbiome. Got to get a microbiome evaluation to figure out what's going on. When you've got these kind of serious autoimmune mechanisms going on, as all of you are hearing right now, there's a whole world that you need to dive into. And it's overwhelming for people. You hope your doctor knows about that world, and they don't. They may know of some piece of it, but not many have the big picture. That's why I wrote The Autoimmune Fix. Read that book, and that's going to give you an OMG of all the things that you have to deal with. But that's what you got to do. When you get a diagnosis like that, you don't mess around with putting your toe in the water. You need to do a deep dive. So if you were my patient and you were sitting here in front of me, and I mean no disrespect to any religious group at all, but this is a come to Jesus talk. You know, and so all of my patients that have ApoE4, that's the Alzheimer's gene, it's the same talk. You need to understand what you're dealing with right now. And this is how you deal with it. You do this and this and this and this, and we check it in 6 months. Now, we should know in 3 weeks that you're on the right track and feeling better, but it's going to take 6 months before we've got evidence that it's working. It's going to take 2 years to turn this thing around, or whatever it's going to take. But it's the come to Jesus talk. So when you've got something like this, when you've got PLS, you don't put your toe in the water, Brian. Good luck on that, my friend. Good luck. Annie says, thank you. I will try and find Leanne Scott. You're most welcome. Leaky gut diagnosis, histamine overproduction of cause of histamine intolerance. Absolutely. And food intolerance can be causing by histamines. Absolutely. And food sensitivities can cause the excess histamine. But usually there's some toxins in the body, toxic chemicals or something. Chemical sensitivity tests are necessary to find out where it's coming from. Okay, Leanne's here. Leanne, hi. Nice to see you're here. Thank you so much. And you two can connect and figure something out to bring me back. I love Australia and love hanging out with you. So that would be great. Christina says, how can you get the immune system to suppress Epstein-Barr virus? Take a load off the immune system. Stop eating foods that your body says are a problem for you, that your immune system is fighting. Clean up the air, clean up the water so your immune system doesn't have to fight the air that you're breathing, doesn't have to fight the water. Begin the base hits program, or talk to my team, have a consultation with my team. You guys understand about autoimmune mechanisms? You can't put your toe in the water. You have to understand the big picture here, and you have to reframe how you look at life. That's the only way that we're going to save ourselves from the incredible increase in degenerative diseases that's occurring right now, is reframe how we look at life. It's not the same world it was 10 years ago. There are more toxins and poisons every single day being brought into our world. You've all heard me say 247 pounds of toxic chemicals per person per day are manufactured or imported into the United States. I don't know what it is in Australia or in New Zealand or what the exact number is, but it's very similar. So you have to take the load off the immune system so it can suppress these viruses. I don't know that you ever get rid of the viruses, but you can put them in remission if your immune system is strong enough to stand guard and keep them in remission. That's what's necessary, right? Okay, everyone. Ingrid, thank you for saying base hit program was amazing. Marzi's giving me a post. Please share, let me know you did. We pick a winner?
Please tell them this exactly.
Oh, tell them about the contest?
Tell them about sharing the betrayal, and then we're going to pick a winner. 15 minutes consultation.
Oh, okay. Okay, and how many? We'll pick one. Okay. So, good. I had this idea. How do we get our people that follow us, you guys, how do we get, how can we acknowledge and reward them, for sharing betrayal? Because I really want to reach 1 million people. Why? Because it's a nice number. It's a 7-figure number. And, it's having an impact in the world. And so I really want to do that. So please share betrayal. And if you share betrayal and your friend registers, Marzi, how do we know? How will they let us know? Okay, so you're going to let us know in the comments section here that you've shared betrayal and your friend registered, and this is on the honor system. You've shared betrayal and your friend registered, and next week we pick the winner. Next week we pick the winner, the winner. Next week we pick the winner from the whole group. Who says to us, yeah, I shared betrayal and they registered. Great, thank you so much. And the winner gets a 15-minute consultation with me on anything you want to talk about. And so please do that. Please share betrayal. And if you want to talk to me, that'd be great. If you're the winner, if you don't want to talk to me, say, I don't want to talk to you. And say, okay, then we'll pick another winner. But please do. It changes people's life. It helps to create the paradigm shift that I'm talking about that we need to produce in the world. If we're going to save ourselves and we're going to save the planet and save our children, we need a paradigm shift as to how we look at life. I see Kirsten's watching. Hi, Kirsten. This is our message. Kirsten's in charge of our social media platform. And We really need the paradigm shift for everyone to think differently about how to protect themselves, protect their families, and protect the planet. And thanks for all the thumbs up and the hearts and stuff, guys. That's really nice. And with that, I'll say thank you very much. Please share Betrayal, share that link with everybody, register yourself, get your friends in there, and I'll look forward to seeing you next week. Thanks again. Bye-bye.